Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. Mzansi's Kasi communities often face a harsh reality regarding the impact of socioeconomic factors on health. This isn't just about individual choices, but it's about the complex interplay between income, education, housing, and even the corner's puzzle shop that shapes health outcomes in these communities. In this episode, public health specialist Dr. Velile Ngidi delves into the lives of Kasi residents, uncovering how limited resources, crowded living conditions, and unequal access to healthcare paint a concerning picture on the canvas of well-being.
I am a public health medicine specialist by training. So this is your usual medical doctor, and then you train further as a specialist. So my specialization is in public health medicine. So this is generally, instead of an individual patient, our focus is very much at population level. So our patient is not an individual as public health specialist, but our patient is a grouping, an entire community, an entire population, and so forth. So when we're talking about ill health.
And thank you so much for sharing that lovely background, Dr. V. I think let's go straight into our topic of today. Dr. V, can you just explain the concept of socioeconomic factors and how they relate to health outcomes in Kasi communities?
If we talk about socioeconomic factors in relation to health, so this speaks to, as an individual, what are the social factors? So where I am raised, where I work, where I live, the people around me, the cultures and the norms that are created around where I live. So those are the social aspects that then shape my life. And if you talk about economic factors within that context, you're then looking at, so what is aspects like employment, access to resources, because that is what economic influences, then that will be influencing myself. Am I poor? Am I born within a rich context? Where I'm born, where I'm raised, are my parents employed and the likes? And also as an adult, am I employed? And the opportunities that creates for me as an individual to be able to adopt certain, habits that either protect or harm my health. So if we're talking about socio-economic factors, so those are all the aspects combined and how they affect health of individuals. But then your question is, when we look at ICAS specifically, right? So I was thinking about the word ICAS because I also grew up in what is now called ICAS.
Yes.
But ICAS back then was totally different to what ICAS is now. So generally back then, if you talk about ICAS, you were talking about a township. When I was probably in my early teens, there were barely any informal settlements within the vicinity of ICAS. So we had access to clean water. We had access to proper housing. These are all the factors that protect health, right? We had access to clean energy, electricity, which is also very important as far as the environment that children are brought up. So versus if you've got access to clean energy versus using open fire for cooking in an enclosed space, it's an entirely different concept. So now if we go back to ICAS and what is ICAS, and maybe let's just reflect on the kind of households that you'd find in your typical ICAS. So you will find household is what I've described where I was raised, ICAS, where there is formal housing, access to clean water, proper sanitation. You then also have a young person or a child that's born to a couple, a stable household. There's a mother, there's a father, they are employed, they have access to distance schooling. So that is one type of household in ICAS. But also in ICAS, you'll have a household that's kind of the opposite of that. So they don't have proper housing. So it's an informal settlement within the vicinity. Because now what you find, for an example, in Umlazi, in Guamashu, in KZN, where I'm from, you'll find that within ICAS now, there's also like a combination of formal housing and informal settlements in one. But they are all kind of grouped within the same ICAS type, a loose description of where people live. But if you take a closer look at this household, there is not a formal housing structure. They live in a shack. They don't have access to electricity. Sometimes you've got what you call izinyoka. Now, is that it? Like what you get all of these informal connections, very dangerous connections to electricity. Otherwise, what are they using for cooking on a daily basis? Do they have access to proper sanitation? They don't, right? So I think we then need to look at these two types of households and then what this means for health. So maybe let's just start with the worst case scenario. So you've got a child is born to a teenage mother, is unplanned, in a family that is stuck in a vicious cycle of poverty. So the trajectory of this child before the child is even born is a bleak one. So we're just moving from bad to worse. So you have this young mother who is now having to look after the small baby. And then these are the kind of children we are also seeing in healthcare facilities with severe acute malnutrition. They can't access support from government. And sometimes even the grant money isn't enough. So this child then is brought up under impoverished circumstances. I don't know if you've heard that in South Africa alone, almost 30% of children are stunted because of inaccess to proper nutrition. And you find often that it's not even about the fact that they are inequalities per se, but these are children we see even in rural areas, for an example. But we are speaking in the context of equality, so I'll maybe stick to that. So this child is now born, so there's severe acute malnutrition. Already the brain has not developed to its maximum potential. So they will struggle to learn. They'll do very poorly at school from the get-go because those first 1,000 days where they are supposed to be brought up and, emotionally stimulated, cognitively stimulated, provided with proper nutrition, all of those things, we're not getting them right. So by the time they are due to be going into early childhood development, into a creche and starting to learn, most of these children are not in early childhood development. So they are set back. This is the worst case scenario in an inequality type situation. We know that these children also are most likely to suffer chronic illness when they're older, which means even employment prospects, they will not go far. So in a way, they're stuck in vicious cycles of poverty and they go into a public school. Probably the quality of education is also poor. As you know, most often parents end up taking their children out of townships. If you're going to have a well-performing school in a township, it's like something that we need to celebrate. So that's why most parents are now taking their children into schools in a distant location. But also, that's an additional expense, right? So if we speak about equality, for me, I look at these two scenarios. You can have equality where a child is born, like how we were born. We were quite fortunate. We're born into a family, a middle-class family. My mom is here. My father is here. I'm born in an environment where healthy social norms are created. I develop value systems that will set me up in life positively. Because we talk about equality, but this is relevant for children in these two scenarios anywhere in South Africa, that is. So you can find a similar household in a rural type setting. You can find a similar household in equality. Amazingly enough, we can also find quite a similar type of situation even in an urban location because you do have urban poor, people who live in urban areas, but in a way it's in informal settlements. It's not necessarily classified as equality. But it's not so much about equality, but it's about the kind of household you could find in equality and what those socio-economic circumstances, then what impact they have on that individual's health. If I go back to the social now, look at the factors themselves and how they affect health, right? So I don't know if you've heard of what we call sustainable development goals. These are international development goals that member countries have committed to as a way, because in a way, you have 17 of these sustainable development goals, but for all of these 17, health is at the center. Because if you're talking about reducing poverty, improving health, reducing child mortality, creating employment, safe environment, and the like. So ultimately, you need healthy people to develop these other sustainable development goals. And these other sustainable development goals, they actually contributing to health. So if we're talking about social factors, so if raised in a family that, let me say, for an example, my mom's a nurse, my father is a policeman, and I am a Christian, and as such, there are certain values and norms that under which I'm raised that become my own. Otherwise, I am born to this teenage mother. It's a child-headed household, and we are all just surviving. My role model is the criminal that lives next door. So the social aspects under which I'm raised then create my own value system. So what does this do for my mental health? And then what I then end up becoming in life. So if I live a life of crime, I consume alcohol because for me, this is the norm. This is all I've seen. I smoke. I engage in unsafe sex practices because these are all the things that we learn from the environment from which we're exposed. And it becomes quite clear then what kind of impact this is going to have on me. So if I start taking alcohol and it's a very young age, alcohol, chronic illness, liver disease, you name it, the next thing is a high risk behavior that exposes me to infections like HIV, gender-based violence. Then it just becomes like a hotspot of all these social factors now that are creating my value system and hence how I live my life. And what does this mean for my health? On the other extreme, my parents are employed and I always see my parents reading, they're always discussing politics about where the world is going. My parents are well educated and they value education. They invest in my education. And for me, that creates a value system. My parents go to the gym, they mind their health. If you create these scenarios, you start seeing that you can have these two scenarios wherever you are in South Africa.
You just touched a bit on poverty, and I'd like us to delve into the connection between poverty and health outcomes. How does poverty and unemployment affect the overall health of individuals living in these townships, and what specific health issues are commonly associated with this socioeconomic factor?
If I were to go back to my earlier example about poverty, because when poverty is most harmful is in the first 1,000 days. So when young women decide I am going to have a baby and they fall pregnant, their nutrition during pregnancy, and then those first 5 years when the young brain is developing. So that is the most critical time within which poverty does its worst damage. Your brain does not develop. It is not given the nutrition that it needs to really set you up on a trajectory in life to really reach your potential. So poverty, one, it means I have no access to good nutrition, but also I don't have access to proper housing. I don't have access to proper sanitation and clean drinking water generally, right? So even before we're talking about poverty, because poverty and its effect, hunger, and its effect on a growing brain, it actually reduces brain development, which means if I was going to be a doctor, chances are the best I'll probably ever do is get like random employment and I'll never finish school because I'll struggle to actually pass every grade, because that is what happens when the brain doesn't develop properly. So that is on the extreme. But then let's move on to what does it mean if I don't have access to proper housing, to drinking water, and to proper sanitation, because now you're talking about infectious diseases. So you're in a household where if a member has TB, there's poor ventilation in the house, I'm likely to get TB. My mother uses open fire to cook in a hut with barely any ventilation. How much impact that's going to have on my lungs, for an example. So you're taking access to clean drinking water. We have to walk kilometers to access water from the local river. It exposes me to all aspects like crime, gender-based violence, and the likes. If I am a child and I have to spend a lot of time helping my household or my home or my parents to access water instead of sitting and doing my homework and just playing, because that is important brain development, that disadvantages me. But also, no access to clean water also means that if someone has got an infectious disease at home, we're not able to wash our hands, which means it's easy to transmit any kind of infectious disease. Also, that disadvantages me. But also now, poverty, you are in the rural areas far from the clinic. Now I'm sick because of all these dynamics at home. I don't have money to take a taxi because the clinic is 20 kilometers away. So these are just examples from the time the child is born, even before the child is born, while the young mother is pregnant, the damage is already starting if they cannot eat properly. So the brain is growing and the child is born, the damage is being done. But then also the environment that this child is living in, also exposure. So these are all the things that just keep piling up. And you can see it's a vicious cycle. If these young children will never develop to a point of employability where they reach their best potential, they'll fall pregnant and give birth to similar types of children with the similar type of circumstances, and you just don't get them out.
So Dr. V, how does limited access to healthcare facilities and resources then further impact health outcomes in these communities?
So this is an example. It's not exclusive to Kasi, but you can find these problems everywhere. It's just all about these socioeconomic factors and how they play, irrespective of where you are. But we'll speak in the context of Kasi. In KZN, which is where I'm, as I said earlier, we have a huge problem of teenage pregnancy. At the moment, we are estimating every 3 months in KZN, 8,000 to 9,000 teenage pregnancies is what we are seeing. So the reasons we are thinking this is happening is that, one, as much as healthcare is free in South African clinics, but young people are not going. So reasons why they're not going, there are different theories. Maybe there's issues about access, and access doesn't only mean being able to physically get there, but also is the environment when you are there conducive to you asking for help. So if you find young people don't go to the clinic because they get judged for asking for sexual and reproductive health services like contraceptives, sometimes, unfortunately, it progresses to a level of needing a termination of pregnancy. Even that becomes a huge struggle. So what we end up happening is they then access backstreet termination of pregnancy or abortions. You end up hearing that you found someone lying dead in the gutter somewhere, right? That's one very extreme example of what inaccess really can mean. But also, you must understand, when we're talking healthcare, we're not only talking about detection of disease. Healthcare is also about prevention of risk factors that actually predispose you to getting any type of illness. So at the moment, the South African Department of Health has adopted strategy to take healthcare services to communities through a community healthcare worker program. So these programs then go into communities. They will screen individuals for any potential exposure to risk-harming factors and then be in a position to guide and advise. So you get to a community, as much as it's health, but health is actually also an advocate. Is an advocate for protecting communities against health-harming factors in the community. So like I said earlier, that access to water and sanitation is key. So then they lobby the other government departments to actually make accessible water and sanitation in those communities where they support, because they know that these are health-harming factors when you don't have access to these resources. And you can imagine when you're in a poor community and health is not able to get there to do all this work and disease prevention type of work, you then end up having individuals who then end up progressing to develop illness. So this is the one. But even when people have developed illness, within this type of model as well, when community healthcare workers supported by nurses go into household, they're able to screen individuals for diabetes, hypertension, you name it. So if this doesn't happen, then you have individuals that live with chronic illness and they don't know it. And this leads to complications. The next thing, they are so far gone, they suffer a stroke, they didn't even know they were hypertensive for years. They go on to the clinic and they're told they have to amputate their leg now because the diabetes is so advanced and they've developed an infection. So then what does that mean for the prospects of someone who lives in a rural community where you walk quite long distances from where the taxi is going to drop you off when you're coming back from work? Employability. So now when people are then more prone to be sick, that also affects their prospects of being able to maintain livelihoods and support families, etc. We know the challenges that people with disability face. So you've got now someone with a severe stroke sitting at home that now needs care. And that's quite a challenge. Most often families can't manage because most families are barely surviving. So it then actually imposes more burden on that individual and their family to survive, because that's where most South Africans are, if you've heard of how bad unemployment is in the country at the moment.
Thank you so much for shedding light on those important points, Dr. V. So in closing, what short message of hope would you give to residents struggling with health issues due to socioeconomic factors in their communities?
It's actually tough because I take a position that when people are poor, often it's very difficult for themselves alone to lift themselves outside of those types of situations. But it becomes then the responsibility of government through government departments to get them support. So my suggestion is that at a household level is to engage with structures that are meant to support them. For an example, it might not apply to all the provinces in South Africa, but in KZN, we have what we call an Operation Suma Sake structure that is collaborated through the leadership in a community. So you'll find that if there's a local chief, they would be involved in that structure, but all the government departments would be there, civil society would be there. The intention of the structure is to identify households that need support, because at the least is access to the resources that the state is providing. So your social grants of various forms is one, but also access to home affairs and documentation, bed registration, and all of those aspects that are critical for them to access that support. I think it's more for us to raise awareness so that we are able to participate in those structures, those who are able to support those families that are affected by poverty of that nature.
Thank you for joining this week's episode of the Health from Mzansi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Mzansi podcast, and your ears are always invited. So Dr. V has explored the complex web of socioeconomic factors that shape health outcomes in Kasi communities. It's clear that poverty, unemployment, and a lack of access to resources create significant challenges. But by acknowledging these challenges and working together, we can create a future where everyone, regardless of their background and postal code, has the opportunity to live a healthy life. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.